So now I would like to introduce to you Jay Cole from the New York State Department of Health, who will be presenting a live tutorial on the refreshed platform for our immunization survey this year. Jay is the head of the New York State Department of Health School Survey team, and they are in the Division of Vaccine Excellence. So welcome, Jay, and take it away.
All right, thank you so much. Thank you everyone for being here today. It's very heartening to see the a level of interest in having this live demo, and we will definitely make sure that everyone's questions get answered either live today or through follow-up. So I'm just going to share my screen. Give me a thumbs up if you can see the health commerce system shared on my screen. Awesome. All right. So usually in former years, you would come in and go into herds to answer the survey. This year is different. So in the instructions that we sent out, excuse me, via our mass email when the survey opened, there's a specific link in the instructions to be able to access the survey directly. But you can also access it through the main HCS portal. If you go into My Content and go to All Applications, it's going to be under Survey Management and Response Tool, or SMART. So just go in your alphabet to S, and you will find it down here. Now, you can see on the far right, there's little green plus symbols. You should see a green plus symbol in the row for SMART. You don't see it on mine because I already added it, but if you click the green plus symbol, it should add it to your My Applications on your home screen, and then you can just scroll down and have it there for quick access in the future. But like I said, if you don't catch all that, we also sent a direct link to access the survey in the instructions. So when this opens up, on my screen, I have this little admin button. You won't see that. You're going to just see surveys and reports. So to access the survey, click Surveys. And then you will most likely only see the school immunization survey for this year. But if you have access to other ones, you'll see those too. So click Open on that. For a lot of you aren't going to have to choose your access level. This might already be filled in. So, but if you have to choose, go to Facility Level Data Access. And then it should bring you, if you have access to multiple schools, you'll have to choose which one. But if you only have access to one school, it'll bring you right into the survey. So starts off pretty straightforward. You've got your school name, which is a required field. If you want to tell us your school district, or if you're a religious or independent school and are part of a larger network of schools, you can tell us that information here. That's just helpful information for us, but it's not required. The same is true of your health commerce system ID. If you don't know what it is, leave it blank. We're just trying to, again, double check that people are submitting for the organization that they think they're submitting for, because sometimes in the past there's been a little bit of confusion as to who's submitting what. But again, if you don't know it, skip it. It's not required. Primary contact, name and title, all this stuff, as usual, is required for one person who we know that we can reach out to if we have questions. You can have additional contacts on here as well. Does your school's HCS ID match your bed's ID? This is a new question. Again, it's for our own benefit of keeping our database as cleaned up as possible. In a perfect world, we would want your school's ID in the health commerce system to match the education department's ID. But if you don't know what your bed's ID is, or just have no clue, just click unknown, move forward, don't worry about it. What you do need to answer is whether your school has an exclusion policy for students without vaccination records or who fall out of compliance. This is part of public health law, and we just want to bring awareness to the fact that that policy needs to be in place. If you don't have a written policy, we strongly suggest that you work with your administration to get a written policy put together as soon as possible, just because it protects you, because you can then point to a policy saying, this is what we do in these circumstances. We're not singling any kid out. We're not trying to, you know, give you a hard time. This is just what we do across the board under these circumstances, and it's because of public health. Now, going into the meat and potatoes of the survey, we have a little bit of a different layout this year. In the past, you had to kind of go back and add in additional grades in herds, and I didn't think it was a particularly user-friendly way of doing things, although you might have gotten used to it over time. This version of the survey is supposed to be, hopefully, a lot more streamlined, user-friendly, so that you only have to answer questions that apply to you. So if you have, for example, pre-K and daycare students in your same program, you would check here, and then the questions for pre-K and daycare will show up. If you don't, just don't check that button. I do want to take a minute here to clarify that we know that there's a lot of schools that give space to a pre-K program, for example, that's run by a different organization. If the administration of your school is not the person that we would be, looking to as the responsible party, if that pre-K program got audited, for example, they should be submitting their own survey under their own organization. There's been confusion about that over the years. It's one of our most frequently asked questions. But if you have separate responsibility or separate administration for those programs, they should be submitting a separate survey, and they should be submitting it as part of the daycare pre-K survey, which comes in the spring, rather than as part of the school survey. This is primarily a K through 12 survey, or a survey of students in that age range, if you don't use grades in your school in the same way. But we do know that some schools legitimately do incorporate pre-K as part of their administration. So we have the option to report those students as appropriate, but if it's not your program, you are not responsible for reporting those. So once we get to the K through 12 tabs here, first of all, in bold, another reminder that public health law says that if the student is 18 or older, not only do they not have to be reported, in the individual vaccine questions, but don't include those students in your totals, because we want to see what the percentage is of kids who fall under public health law who meet the requirements of the public health law. So if they're 18 or older, just leave them off the survey completely. So if you are, for example, a middle school and you don't have a kindergarten, you would start off on the kindergarten tab by just saying that you have 0 kindergartners. That will answer this required field here. And all you have to do is move on and do that for each grade where you don't have students. So it's a little bit time consuming, but shouldn't be too big of a lift. And let's say that your middle school starts at grade 7. So we'll just, grade 5 already. There we go. So we get to grade 7. Let's say you're a pretty small school. You've got 50 7th grade students. The next question you're going to need to answer, and again, we have the worksheets that are available on our school website, which I'll show you in a minute, to help you prepare this data in advance. It's going to ask you next, how many students in 7th grade have any medical exemptions? Usually this is a pretty small number, so you've got 1. It's going to then move on to DTaP, and it asks you how many are up to date with their DTaP vaccine. Let's say that 45 of them are. There's 1 student who has a medical exemption. And then if you've got kids who aren't up to date, but don't have a medical exemption, hopefully those kids are all in process. So you're going to save those and include them under number of 7th grade students in process down here at the bottom. So these numbers going across probably will usually add up to your total number of students, but sometimes they might be a little bit under for different reasons. However, if you accidentally had a typo and said that there were 55 up to date instead of 45, you're going to see an error message come up that says, hang on, that adds up to 56 students. That's more students than you told us you had in that grade. So it's just going to remind you to go back and double check. Now, one of the questions that we had, particularly about DTaP, I believe it was about the booster and things like that. So if a student has all of the vaccinations in a series that they are expected to have at that age, then they're up to date. If they are on a catch-up schedule and are a little bit behind, they would be in process. And if they don't have their booster yet, that's a separate question. So the Tdap booster is listed separately down here. So moving on to, I'm not going to go through all of this in all this detail for every single grade, but I do want to do a general tour of these types of questions, and especially to highlight that for vaccines where we accept blood work, titers, lab results, whatever you want to call them, we're this year splitting those out. So I'm going to focus on varicella, actually, because it has the most different possible options. If they're up to date in their vaccine series as standard, then enter them here. If they are using a titer, enter them here. If they are using a note from their doctor that says, I can verify this kid had chickenpox, enter them here. But anything in these three would allow them to be included in the completely immunized section. So if they meet the requirements of public health law, in other words, they have evidence that is appropriate and acceptable for being immune to that disease, then they can count as completely immunized. So just because we've split out the titers and the history of disease this year, that's not going to change how you count them for number completely immunized. The only time they don't go here is if they're in process, you don't have a record for them, or if they have a medical exemption, which has its own field. Another thing I wanted to flag up, this question at the bottom here, number of unhoused 7th grade students enrolled. This is referring to homeless students. As in the previous surveys, the question was worded. This is noted under the little tool tip here. And the change of vocabulary is a little bit confusing in the education world. We had it pointed out to us by our friends at the education department. But in public health, we tend to try to use person-centered language that is putting the emphasis on sort of the structures and systems that lead people into the situations they're in. So rather than saying, oh, this is a homeless kid, we're saying this is a child. That's the important thing. They happen to have been unhoused through various systems or things that befell them. So that's all this unhoused means. It's just a different way of talking about homeless that we in the Department of Health are trying to move our language in that direction. So apologies if that is confusing in any way. We've had some questions as well about medical exemptions if they're in the process of being approved. What I would suggest in that situation is list them under medical exemptions, but then put a note down here saying one of these exemptions is, still in the approval process, something along those lines. So list them wherever it makes the most sense to you to list them, but then flag it up for us in the notes section. And again, once you're done with the tab for this grade, you would move on to the next grade. Make sure you put a number in each of these tabs, because otherwise, if you try to hit submit, it's going to give you an error message. So if you have 0 10th grade students, make sure you add that 0 in. And as long as you've got an answer in each tab, it should go through pretty smoothly. Now, when you get to the bottom and you've finished grade 12 or whatever your last grade is, you would hit submit, or if you're not sure and you want to wait for more paperwork to come in or whatever the situation, or you had to pause partway through, you can hit draft. That's going to save your responses, but it'll also flag to us that you're not done with it yet. Once you've hit submit, you can go back. Hold on, let me show you. Oops. Now see, it's mad at me because I didn't. So I can't. Oh, it did put a little X by the submit. If I go out and back in, I'm hoping it will show you that you can open your survey back up to make edits. Oh, that's interesting. Okay. It's good that we're doing this as a live demo because I was rushing to try and get through. If you have error messages that you don't resolve before you leave the page, it's going to clear your data. So make sure you pay close attention to those error messages. For now, I am just going to quickly put something in every required field so that I can show you that you can go back in and edit it without having to start over, I promise. This is the joy of live demos. Okay, draft. Okay, there we go. When you hit draft, it will also send you an email telling you that you've saved it as a draft. Okay, here we go. So it says survey was submitted, blah, blah, blah. If you need to correct any information, please do so and resubmit. Just hit the proceed button, and then you can go back in and change anything you need to change. When you're finished, you can also use the print button up in the upper right-hand corner at the top of the page, and that will give you a PDF that shows you all your answers. And I'm going to try to show that to you. Here we go. This one isn't obviously very helpful because I just put gibberish, but it will split out all of your tabs and show you grade by grade what you put in. It won't show you error messages because, like I said, it won't save properly if you have any error messages still on there. So just, watch out for that. If you have error messages that don't make sense to you, please send us an email at osas@health.ny.gov. I'm going to be repeating that email address a lot of times because it's the #1 way to reach us with questions really about anything school related. So osas@health.ny.gov is where you're going to get answers if you have error messages, if you have access issues, if you need clarification about what each question is about. Make sure you also look at the tooltips, these little little question marks because we tried to build in as many answers to questions as we could in these little tooltips along the way. But if there's anything that's not answered or not clear, please don't hesitate to send us an email. I think that is a pretty thorough overview of the things that would occur to me to tell you about how to fill out the survey. So I'm happy to open it up at this point to answer any questions that have come up.
So someone says that they usually do the immunization for the whole district, but they see it will only let them do their own school now. Is there a way for them to still do the survey for the whole district?
No. So in the past, I think there has been a little bit of lack of clarity in terms of the permissions that have been added into the surveys. We want to see one survey for each school. So if it's, if it's one campus where all the kids are interacting, then that might be a case by case situation, but we would expect to see a separate survey for your elementary school, your middle school, your high school, if you have more than one elementary school. Each of those should have its own ID within the health commerce system, and we want to see those kids separated out. Even if you only have like one big building, in order to access it properly, you'd need to access the school organization type within HCS because we haven't given the district type of organization access to the survey because it's important that we split them out.
So if I understand you correctly, then each school building has their own identification number and should be reporting separately, correct?
Yeah. Yeah. And if they don't, just reach out to us and we'll get you set up with that. The process for getting new, organizations and new directors set up is a lot quicker this year. I know in the past you had to have actual like hard copy papers that you had to get notified and mail. That's not the case anymore. If you send us an email, we should be able to get you set up within, the same day or the next day because it's just an online process now. You'll have to show us or someone from our team some identification just to prove who you are before you get access to the system. But aside from that, it's a pretty quick process now, so it shouldn't be too much of a burden.
And then we have a question. Is there a cutoff date for new entrants or enrollees to be included in the survey?
That's a good question. The survey is intended basically as just a snapshot in time. So on the day that you're filling it in, fill it in for who you've got. If you want to go back and make edits, you can up until we close the survey. The due date for the survey is December 15th. If you have extenuating circumstances and feel like you might need an extension, that's something we can, negotiate, send us an email. But just worry about who's in your school enrolled today, the day you're filling it out. I also want to draw your attention to, while we're here, so this is our DOH school immunization website. And right at the top here, there's another link to the fraud awareness website. There's a list of providers here where if you have paper-only records from these providers after a certain date, they're not to be accepted. Our hope is that if you become aware of a student having records that are not acceptable based on this list, that you're going to do your due diligence and follow through with making sure that they get vaccinated and potentially, excluded in the meantime if they have to be. We're not necessarily expecting you in the middle of the year to go hunting through all of your records to find these, but it's just something if you are reviewing records that we would expect you to also be aware of if you're doing that process.
Okay, and someone is asking, how does one find their health commerce organization ID?
That's another great question. So I'm going to go back to home. Whoops. I'm going to go back to home. There we go. What I would recommend is if you can log in to HCS, there is a tool called See What Roles I Hold. And then if you go to user and put in your either your first and last name if it's not a super common one, or the ID that you used to log in to HCS and hit search, it will show you, well, in this case, there's a lot of people with a similar one to me, but it'll show you the different roles that you have. And so mine says New York State Department of Health Center for Community Health. And this number next to it, this 36307, is the ID for that organization. There we go. But like I said, if you are filling in the survey and you can't get this to work, you can't figure it out, and you're not sure, it's fine to just skip. I will touch on in process real briefly. Usually kids aren't in process for very long. Either they get the next dose on the date that it's due, and then they would be, up to date, or once again in process for the next dose if it's a longer series that they're catching up on. Or if they pass the date that it's due by 2 weeks, they're no longer in process and, under the law need to be excluded. So you probably won't have a lot of in-process kids since the window for each kid to be in process is pretty short. But if you're not sure if a kid counts as in process or not, again, just drop us an email. In process is very specifically for when a child is following a catch-up schedule. So if they're not actively on a catch-up schedule, they're not in process, they're just out of compliance.
For the Tdap booster, how do we record the students in 6th grade that are not yet 11 and haven't received the booster but aren't required until 11?
Yes. So there is a field. Let me come to 6th grade again. Hold on one second. There's a field to list the number of students in the grade for 6th grade specifically who have not yet turned 11. So I want to show you how that scenario would work. Let's go to 6th grade. Okay. So for the Tdap booster, you would still include the total number of students who have actually gotten the booster. But when you say completely immunized, anyone who is under 11 would still count as completely immunized, even if they don't have the booster, because they're immunized for that that age, if that makes sense. But then enter the number here so that we can just make sure that any discrepancies add up. So if you've got 12 6th graders who are less than 11 years old and they have their their DTaP is complete, they'd still count as completely immunized. But we would expect to see a lower number here. It would be what, 38 if I said there's 50 students and 12 of them are under the age of 11. So we would expect to see a 38 here, and we would add that to the 12 and be like, yes, that all makes sense. I hope that was a clear explanation. I know it's a little bit complex.
So if a child has a medical exemption, they are not counted in the fully immunized category, correct?
That is correct, yes. Another way of thinking about it is if a student is on your exclusion list for if there's a disease outbreak, then they wouldn't be counted in the completely immunized. But if they don't need to be on the exclusion list because they have all the, the proof and doses that they need, then they would be completely immunized. And like I said, if they're in process, they would be listed separately as in process, even though they're still in compliance, hopefully. They're following the catch-up schedule, but they're still not fully immunized for their age. So thinking about it in terms of would you need to exclude them if there was a disease outbreak is another way to help you answer that question.
If we have a McKinney-Vento student who is not fully immunized, where do we capture that? It is not a medical exemption or missing records, just incomplete records.
So just list the number of, sorry, there was an alarm going off in the background, but it's fine. Just list the number of students who do have all of their vaccines in each case. And then there's a place to put, McKinney-Vento or other kids down here. So if you want to point out in a note the number of, incomplete McKinney-Vento kids, that might be helpful as well. But mostly we're just going to say, okay, if things don't add up, are there reasons? And one of the things we're going to look at is your number of unhoused students down here to see if that makes sense.
Somebody is asking where can we find templates so that nurses can do these on paper before doing them electronically, and there are worksheets available.
Yes. So let me go back to, so this website here, so health.ny.gov/prevention/immunization/schools, sorry, it's kind of long, is where you're going to find all the resources that we have available to you. And the worksheets are under K through 12, 24, 25 immunization worksheets. And going through this process, there's a few cases where, for example, we don't have a field on here for number of students under age 11 because this is generalized for working with any grade. But this is the template that is available for you to kind of do some of the pre-work on. You can also, I believe, if you need a blank copy of the survey itself, drop us an email because I'm not sure if there's a quick and easy way for you to get that yourselves, but there is an easy way for us to get it, so we can send you that as well. But the worksheets are the number one tool for preparing to fill in the survey.
Great. Someone said they tried to hit submit, but it wouldn't let them, so they had to save their survey as a draft for now.
That's fine. At the end of the day, when we close the survey, if your survey says draft, we'll still take it. It's helpful for us to know when you're done, but when the survey period is done, everybody's done. So we're just going to take the data that you've got in there. So if it won't save, we can help you look into why. And, I'm going to sound like a broken record, but drop us an email if you have a question about it. But you also don't need to worry too much because it will save your data.
If you have an error message, but save as draft, can you go back and edit?
If you have an error message, it's not going to save properly until you figure out what that error is, unfortunately. So yeah, it's important to look into where that error might be coming from.
Let's see. How do we go about reporting our preschool and daycare programs that are in separate buildings but run under one school?
So if it's run under your administration and they are, on your campus, if they don't have a separate ID within HCS, and if you're not sure, you can ask us, then you could include them under the pre-K. Here's the little checkbox for if you have any pre-K or daycare students, and that makes the questions show up for that age group.
Somebody's asking, do you print your report prior to submission, or can you print it after submission just for keeping it for your own records?
I would print it after submission because that's when the system is saving the data. So to see all the data show up properly, I would hit print, or at least hit draft and then print. But yeah, you want to make sure that it's registered any changes that you've made.
How do we get into the survey again?
Yeah, so there's a couple of different options. I'm going to bring up the instructions since we're right here. So if you have the instructions that we sent out via email at the beginning of the month, and I think again a week or two ago, but again, it's also linked from our website. So the link is, here's the link for the health commerce system. But then if you scroll down to page 10 to get straight in, there's a link right here. Otherwise, if you're in the health commerce system, you've logged in, go to My Content, All Applications, and then the survey is now in the Smart Survey Management and Response Tool platform. So go to S, and it's down here. And then you just click Surveys, and you'll see, probably you'll only see the school immunization survey. You know, there's a lot of, actually, let me bring it up because I'm always trying to plug this. So on our requirements PDF, on the back, there's all these footnotes. And I know it looks like small print, et cetera, but it's actually a lot of really helpful information for this kind of like nitty-gritty question. So it tells you when it's going to count Tdap for DTaP, when that is going to count for their booster, you know, all that kind of ins and outs of the weird and wonderful situations that can happen. So start with this document, start looking through the footnotes for that particular, you know, it'll tell you if you're looking at, you know, this range of things, look at footnote 3. These footnotes are a treasure trove of detailed info about those kinds of scenarios. So start there. And if you're not sure, then send us an email.
Somebody is asking, what attendance number do we use? How many were enrolled at the beginning of the year or currently are enrolled when the survey is done?
Currently when the survey is done.
Do you want the number of unhoused students even if they are in compliance?
CDC asks for that. So if you don't have a policy saying that you shouldn't or can't share that information, then we would like to have it if possible. Actually, let me share another good resource, which is the CDC catch-up schedule. So the details of like what counts for what is found on the CDC ACIP catch-up schedule. And that tells you what the minimum intervals are between doses. It tells you all the specifics of, well, if it's at this age, it's this, but if it's that age, it's that. So start here. And if it's a really complex situation, again, just reach out to us and we can help you make sense of it. In process isn't like a kind of catch-all bag for if they don't have enough doses. It's a specific like status that they're in while the parents are actively getting them caught up.
Do school nurses need to be listed as the data reporter for their building in the HCS in order to enter data for their respective building?
So you would need to have either a data reporter, there's a different role, I think it's HPN coordinator. You need to have one of those roles in order to to enter the data. Yeah, because otherwise, when you go into Smart, you're not going to see any surveys available to you.
For those of you that we didn't answer today, we encourage you to reach out via email or phone call, and we will be happy to either try and answer your question or pass you on to the Department of Health, who can then answer those questions that we cannot on your behalf. Again, the
I
email, go ahead.
Sorry, I would just also like to flag because you mentioned a phone call. We often get people saying, I tried to call your office and didn't get a response right away. Most of the time when we get phone calls, they go to voicemail and then it takes a while to get them processed. If you want a quick answer, I promise you the fastest way is our email address because there's multiple staff looking at that actively throughout the day, whereas we only check the voicemail like once a day. So if you want a quick answer, osas@health.ny.gov. If it takes us longer than a day or two, it's probably because we've had to consult with other people to get their expertise. So we like to get answers out within 24 hours. Sometimes when there's a high volume, it can be a little bit longer than that, but it's still unfortunately probably going to be quicker than if you call us. So I'm just putting that out there for your awareness.
Good. So I want to let everyone know that that email for Department of Health is osas@health.ny.gov. And if you don't remember that email, you can remember our email and we'll help you get there. Our email is nyscsh@monroe, the number 2, BOCES.org. I think that's harder than OSAS's email, but if not, you have our phone number here at the center. Just call us. We'll get you that email. We'll make sure you get the information you need. So I just want to thank everyone for joining us today. I want to thank you, Jay, for sharing your tutorial skills with us on this new platform. I'm very excited to use this. It looks not hugely different from the HERDS one, and I think it might be a little easier. I'm a little biased.
We think so too. We hope so. But we also welcome your feedback. So if there's something that specifically doesn't work, tell us that as well. Or if you like it, please tell us that too. We like positive feedback too.